In 1978, primary health care was endorsed by the World Health Organization as the primary means by which the health of all nations should be promoted and maintained globally. Since then, primary health care has assumed a prominent place in healthcare discussion, reports, and strategies worldwide. Primary health care is recognized as integral to any strategic plan for the health of a population's citizens.
Primary health care, I think, really is the way that we're going to reform and sustain the current health system.
Community members are working together with the community partners, and therefore they're building on their own strengths and just becoming more empowered.
Primary health care is about health for the people, by the people.
With respect to nursing and primary health care, the World Health Organization identified nurses as being key players in primary health care. The International Council of Nurses agreed and endorsed primary health care as an effective framework for nursing practice. Community health nurses in particular have been intricately involved in many primary health care initiatives. For example, in the province of Newfoundland and Labrador, the first primary health care demonstration project in Canada was launched in the late 1980s, with community health nurses being significantly involved in all stages of the project. Another example, in the early 1990s, the Community Health Nurses Association of Canada partnered with the Canadian Public Health Association to produce a document defining the roles and responsibilities of community health nurses in Canada based on a primary health care framework. In this program, the term community health nurse refers primarily to public health nurses. First of all, what is primary health care? The World Health Organization defines it as essential health care based on practical, scientifically sound, and acceptable methods and technology, made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every state of their development in the spirit of self-reliance and self-determination. It is the first level of contact of individuals, the family, and the community with the national health system, bringing health care as close as possible to where people live and work. Let's look at this definition more closely in terms of how it relates to community health nursing. It mentions that primary health care is essential health care. The World Health Organization identifies 8 elements of essential health care and asserts that if these elements are provided to a population, then there is an increased likelihood of that population being healthy. Note that all 8 elements are health promotion activities, a prime focus of community health nursing. Education about health problems and methods of preventing and controlling them, promotion of food supply and proper nutrition, adequate supply of safe water and basic sanitation, maternal and child health care, including family planning, immunization against the major infectious diseases, prevention and control of locally endemic diseases, appropriate treatment of common diseases and injuries, and provision of essential drugs. Note also that most of the elements have an asterisk beside them. These are direct services that are commonly provided by community health nurses, and these nurses can also be indirectly involved with the remaining elements. Going back to the World Health Organization definition of primary health care, we can see that it is largely community-based in its orientation. The community is the prime practice setting and a key target of service for community health nurses. The primary health care values of social justice and equity are shared by community health nursing. Other reasons for the close fit between primary health care and community health nursing are inherent in the definition of primary health care.
I think community health nurses are really well positioned and they're in very strategic positions to move forward the primary health care delivery model because of some of the basis of their practice. Their practice is very much based on networks and relationships, And in a lot of cases, they form those very quickly in their communities because they're essential to getting any and all of their work done. So they're able to develop that skill, they're able to find those partners, and they're able to work with them in whatever program that they're delivering. And that's very transferable then in terms of operationalizing a primary health care model.
Even the very nature of what we're guided by, we're client focused. We look at health promotion and wellness. We look at working with communities, you know, with where they are and what affects their health. So if you take all that into consideration, like, that's really primary health care, and that's really what community health nurses do anyway.
Community health nurses have huge respect in terms of in their communities. The communities, for the most part, really see them as a resource person, as somebody who has a lot of credibility, who knows what the assets are in a community, but also has a good handle on what the challenges might be in that particular community.
The World Health Organization identified 5 foundational principles of primary health care which guide healthcare practice, no matter what level of healthcare is being offered. These principles are an integral part of the Canadian community health nursing practice model and are also embedded in the core competencies for public health workers in Canada. Let's look at these principles and how they are operationalized in community health nursing practice. The principle of accessibility refers to health services being universally available to all people, regardless of where they live, their cultural heritage, their income level, and so on. Facilitating access and equity is one of the standards of practice for community health nurses in both Canada and the United States.
A number of years ago, a need was identified by a Women's Health Issues Committee that we had here. And they identified that women in Green Bay didn't have access to their annual Pap test, clinical breast exam, because a lot of them didn't have a family doctor. So what happened was public health nurses in the area, under the guidance of family doctors, we learned how to do Pap test, we learned how to do clinical breast exams, and we now offer that service.
Or an enlargement of lymph nodes up around your collarbone here, or even up and under your arm.
A particular concern related to accessibility is with respect to the hard-to-reach groups or individuals in the community. For example, the homeless or the poor. One of the characteristics of community health nursing is its focus on such vulnerable populations. Geography can also be a challenge in terms of accessibility.
There are marginalized families that don't access our programs, and that's why we have come up with the Making Connections outreach program to try to reach those families. So we may get a referral from child management or a referral from public health about these families that they've heard that have moved in, or we may contact the community to see who's bought a house in the area recently and if they have children under the age of 6, and we'll just give them a phone call. Or we also have welcome wagon packages with all the information about the community that will drop in, and information about the Family Resource Centre that they can give us a call, and we might follow up on that then and just try to meet with them, and we'll do home visits and book bag programs with that family then if they're interested. And it's amazing to see that they actually do have been coming out and enjoying the programs.
The principle of public participation refers to the right as well as the responsibility which people have to make their own decisions about their health and the health of their communities. This means that they participate fully in assessing their communities, prioritizing their needs or concerns, identifying their strengths, and in the planning, carrying out, and evaluation of activities to address their concerns. Partnering with the community and its members is one of the standards of practice for community health nurses in both Canada and the United States.
Community members are living in the context of community, so they're looking to the community for support in their social, emotional, spiritual, physical, intellectual needs, and that's what we're there to provide for them. So if they're more involved, then obviously they're going to do better in the long run. On our board of directors for the Family Resource Centre, we have 50% parents and 50% community service providers.